Hello, I'm Jenny Sanchez. Welcome to Sullivan 180 Presents Take 5. Our guest today is Jill Hubert Simon from Sullivan County Public Health Services. Jill, thank you for joining me.
Oh, thank you for having me. I'm glad to be here.
It's our pleasure. Could you please introduce yourself, your title, and tell us a little bit more about public health?
Sure. So, as you already mentioned, my name is Jill Hubert Simon, and I am one of the public health educators for Sullivan County Public Health. Public health does a lot of different things. Obviously, right now we're very busy with doing some vaccination clinics, but we do those throughout the year for routine vaccines as well. We do that. We run the drug task force out of our rural health network. And of course, we do health education, which is a big piece of what we try to do to make our community healthier.
What kind of services and programs do you specifically offer?
So specifically, it's kind of hard because we do a lot of different things. So I know I'll forget something, but we run routine vaccine clinics. We have nursing services for people who are homebound. I'm going to spend a little time talking about education because that's what I like to do. So for public health education, we do any type of health related outreach and education. We're always available to do community outreach, to do classes. We also do Narcan trainings. We participate in freedom from smoking trainings. But pretty much anything health related that the public is interested in, we're able to go out and do and provide education and outreach.
And as the weather warms up, what about tick safety would you like the community to know?
So my main job, and I guess what people probably best know me as in pre-COVID times, is the tick check. So we do a lot of education on tick. Right now is kind of the biggest time for tick season. Ticks are around year round. They're here even in the winter time. So we always need to be vigilant. It is important to remember that tick illness is preventable. It's 100% preventable. We just need to be vigilant. The best thing that we can do is to make sure that we're doing tick checks from head to toe on ourselves, our children, and our pets every time we come in from outside. For most cases, it takes a tick 24 to 36 hours to transmit disease. So if we do those tick checks every time, we're going to find them really before they have a chance to make us sick. And that's something, even young kids can do. And it's really important. And we can't forget our pets because they sometimes will bring ticks into the house, and we really don't want those ticks to stay in our house. Insect repellents are important for the skin. We can also treat our clothes with permethrin, which is a tick killer, very easily found in pretty much any store around, and it's very effective, particularly for people who work outside, like to do a lot of hiking. And it just has to be shoes and socks. I do my kids' shoes when they go to camp, and it's worked pretty well. We don't like to wear long clothes. That's kind of been the guidance is if we're going to out, especially hiking, that we wear long pants tucked into our socks and long sleeves. So those are all really easy things that we can do to prevent ourselves from getting sick. And I do have to say the easiest and most effective way to take a tick off is simply with a pair of tweezers. The thinner tweezers, the better. We don't want to burn the tick. We don't want to put Vaseline or anything else on the tick because the goal is to get the tick off of us. And, if it's feeding on us, we want to remove it as quickly and as safely as possible. And we're going to remove a tick simply, very similar to taking out a splinter. So we just grab the tick close to the skin and pull it straight out without jerking it because we want to try to get the mouth parts out as well.
What can county residents do to help public health or help spread the word?
So well, share information. We have a lot of information out there. And again, if we're talking about ticks, sharing the information, talking to everybody else. And we really do get a lot of word of mouth. So we're out, we try to get our information out, and public health has a lot of great services. Unfortunately, we find that people might not know everything that we have available. So, if the community has used our services and, hopefully have had a good experience, let your community know and let your family and friends know. We want to help and we want to make our community healthy. And we can only do that if we can get our services out there and we can get our education out there. So, word of mouth is really important.
How can people stay in touch with public health?
So we've got a lot of ways that we can keep in touch with us. Obviously, you can call us. You can email us. We have a Facebook page, which we're fairly active on. We try to put a lot of information up on that. We're also part of the Family Services Division of Family Services Instagram page. So a lot of public health stuff gets up on Instagram. We have a website. We've got a page for all of our programs with information and contact information. But probably social media is the easiest way, and that's the most current information. We try to get healthy tips out there and information about what might be going on in the community and programs that we're running.
Well, Jill, thank you so much for being here and for sharing about public health and tick safety.
Thank you so much for having me. And we really hope that we can stop some tick-borne illness, because it's the last thing we need after we're coming out of the last year and a half. So I just remind people to be vigilant, do those tick checks, and stay healthy. And let's not let those ticks make us sick, so we can enjoy our time outside.